Hello, today we are going to talk about the various positions in a cephalic presentation. Please don't mind this dummy or this model. The neck is already broken, so I have to manage it like this. Okay, so the presentation is cephalic, that is the vertex presentation. The head is the attitude is flexion. The presenting part, this is the presenting part. The presenting part is the part which overlies the internal os. This is the presenting part, that is the vertex. The presentation is the cephalic, attitude is the flexion, and your denominator is a bony part, okay, which comes in relation with the maternal pelvis. So in cephalic presentation, your denominator is the occiput. Why occiput? Because occiput is the region which comes in contact with the maternal pelvis. So here the denominator is the occiput. Presentation is cephalic, flexion is attitude, presenting parts is the vertex, and the denominator. Denominator is an arbitrary bony fixed point on the fetal head which comes in relation with the maternal status. And next is the position. The position is the relation between the denominator and the various quadrants of the maternal pelvis. If we divide it into quadrants, okay, the various positions there are mainly 8 positions in cephalic presentation. Okay, so as you know, this is the pelvis, this is the anterior portion of the pelvis, this is the posterior portion of the pelvis, this is the right side, and this is the left side. So there are, what I told you, that there are 8 positions in a cephalic presentation. Your position is determined by the denominator with the help of denominator and the pelvis. Okay, so the first position here is this is the occipito anterior. Why occipito anterior? Because occiput here is the denominator. Okay, the denominator is in relation with the anterior aspect of the pelvis. So this is the anterior occiput. This is the left occipito anterior. Why left occipito? Because this is lying on the right side between the occipito anterior and between the transverse director. As you can see, this is the denominator. Okay, the bony fixed point which is attached to the maternal pelvis is in relation to the iliopubic eminence. Okay, so this is the left occipito anterior, and this position is the left occipito transverse. Why left occipito transverse? Because it is lying along the transverse diameter of the pelvis. So this is the left occipito transverse. This is the occipito anterior, occipito posterior. Why occipito posterior? Because the occiput is, the denominator is touching the posterior portion of your sacrum. Okay, so likewise this is the right occipito posterior, because it is lying between the your sacrum and this is the right transverse right occipito transverse. Okay, your denominator here is, it is touching the right sacroiliac joint. Okay, so this is the right occipito posterior, right occipito transverse. Why right occipito transverse? Because it is along the transverse diameter of the pelvic inlet. This is right occipito anterior. So there are 8 various positions, which is the first one is the occipito anterior, left occipito anterior, left occipito transverse, left occipito posterior, right occipito anterior, occipito transverse, right occipito posterior, right occipito transverse, right occipito anterior. So the most common position is the LOT, that is left occipito posterior. The anterior portions, left occipito posterior, left occipito anterior, and right occipital and here are the normal positions. Among these, your LOT is the most common, LOT and LOA, while your posterior portion, that is right occipital posterior, left occipital posterior, and your OP are the null positions. Okay, so among these three, your occipital posterior is the most common null positions. Okay, thank you.